We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the August 10th media availability. Thank you for being here with us.
Thank you.
Would you like to start by addressing any issues to the community?
Just one thing I wanted to note, when we do release our case counts today, it will reflect us adjusting the case count by 3. And that's because we had 3 individuals who were tested at an out-of-the-area laboratory that gave false positive results. They recognized that error, but they had already reported it out, and they reran the specimens. They were negative and confirmed as negative. So those 3 individuals were taken off our list of positives, and our case count will be adjusted accordingly today.
Thank you. The Redheaded Blackbelt asks, we understand staff at another nursing home in Humboldt County has a positive COVID test associated with it. Can you talk about what public health learned with Alder Bay that you will use to inform your response to this outbreak? What's working to keep our elderly healthy? Is Humboldt County or the state helping to provide more PPE, or has that shortage been covered?
So just as a correction point, we don't have an outbreak. We have a single case, and we are hoping that we can see that just stay stable. But of course, it's always a population that we're very concerned about. I think lessons learned are that there are lessons learned across the board from the facilities themselves, public health, the state. And what we have in place now, we've been working ongoing with facilities to ensure that they are keeping track of PPE, that they have adequate supplies to respond should a case emerge. We're working with them on procedures and policies about how to operate safely when a case emerges, because we know that that is very likely to happen over the course of this pandemic. And I think they are better prepared now than ever to be able to respond. I think the fact that many of these facilities over time have become much more proficient at how they use PPE is really helpful. We provide assistance from an infection control specialist who can go on site and assist when we have cases in facilities, so that we can make sure things are being done and questions are being answered readily. And so just providing that extra resource for them. Skilled nursing facilities already have infection preventionists on staff, so that's been a huge feature as well. So I think we are better positioned by virtue of both our experience and time with this pandemic to address any cases that emerge in these settings. And again, with ongoing testing, we're very hopeful that we can see minimal transmission. My hope would be none from a single case, but we shall see.
Thank you. The Redheaded Blackbelt asks, with nursing homes traditionally staffed by low-paid workers who are often employed at multiple jobs to keep their finances afloat, what can be done to support the staff by Humboldt County Public Health? And do you have suggestions how our community as a whole can support both the staff and the elderly?
Well, as I'm sure people are aware, there are, in the guidance provided by the state, employers in general are supposed to have plans in place to be able to help workers who need to be out due to isolation or quarantine. So from that financial standpoint, I think it's an excellent question, because I think what we can all do to support the staff and the elderly is what we've been talking about for months now, which is people limiting their activities outside the area, limiting gatherings, distancing, using facial coverings consistently is what helps to decrease transmission in our community, decrease the number of people walking around who have been exposed or are infectious, and that actually protects people in these facilities. And so again, it's something all of us can do to help decrease this from happening, decrease how much this happens in the future.
Thank you. The Redwood News asks, with kids heading back to school, Fortuna went back to in-person today. Some other smaller schools will be going back to in-person instruction as well. And many parents worried or anxious about sending their kids back. What is your advice for parents on the best way to keep their kids safe this fall?
So I think this year it's really important that parents are emphasizing to their children the importance of facial coverings, hand washing, hand sanitizer, getting them all used to those rituals that we have all been working with for quite some time now. The whole distancing piece and talking them through that. I also think that parents need to be really active at monitoring their children for signs and symptoms of infection, so that we are not sending children to school when they are ill, because that's going to keep everyone safer when they do go to school. I also think that it is important that families, again, keep activities to their family, for the most part, their household unit, as much as possible, so that the number of different places where children may be exposed to other children or adults is small. In the best of all worlds, it's school and home. And so I think those things, again, the gathering issue for families, having multiple households together, those things add to the number of exposures children have. So if they are in a cohort at school of children, if they are only in their home after school, then it really can help to decrease the chance for infection for everyone.
Thank you. The Redwood News asks, there has been a lot of talk lately about a COVID-19 vaccine and the trials for a vaccine. St. Joseph's Hospital was involved in a clinical trial for remdesivir as a treatment. Is Humboldt County going to be involved with any vaccine trials? If so, what is that going to look like?
At this time, we don't have any information about local involvement in that. Most typically vaccine trials are centered around large academic institutions and facilities in large population centers, so that they can access a really large number of patients in which to enroll in studies. So I don't know that that will happen for us here, unlike medication treatments where they can be parsed out across the country. Vaccine trials tend to be a bit more focused than that. But we'll certainly, if someone has a proposal to engage local populations, we'd be happy to talk with them.
Thank you. The Redwood News asks, can you give us an update on the flooding/plumbing problem that happened at the public health lab on Friday? How much of the lab was impacted? Was any equipment damaged? Were any test or collected samples damaged? Has testing been or will it be impacted in any way?
Well, we were really lucky in the sense that the flooding primarily affected the lower levels of the health department, particularly a few offices, including mine. But that area has been, dried. We've had fans and heaters going to try and get that all dry and then get it cleaned up so that we can get back into those office spaces. The lab itself did have some water, but it did not compromise the overall operations of the lab. I believe they were actually able to run through about 100 specimens that day, in spite of what happened, which is really a testament to the fortitude of our lab folks. I mean, they are just incredibly dedicated to getting the job done. So they, mopped up a bit and cleaned off what they needed to, and they got to work. So that was really helpful. I'm not aware of any large pieces of equipment that were damaged, certainly not our testing equipment. Whether there were some small countertop things that may have had some water damage, I don't know. But it did not impact operations, other than the fact that they had to start out a little bit slower in the morning and then catch up over the course of the day.
Thank you. The Lost Coast Outpost asks, last night the director of the California Department of Public Health resigned after it came to light that the state failed to receive results of 250,000 tests conducted by Quest Diagnostics between July 1st and August 4th as a result of a technical glitch. How did this glitch affect Humboldt County's reported testing numbers last week? We note that the two large reports of positive cases last week were on Wednesday, August 5th, and Thursday, August 6th, the 2 days following the correction of this glitch.
So first, I just want to note that I don't know that there's any connection actually between the resignation last night of the state health officer and the laboratory issue. And obviously, this is an enormous operation across the state, and the state health officer certainly, although ultimately overseeing this pandemic response, obviously is not designing the computer systems that operate it. I think that, as I mentioned, I think last week when we spoke, it's always hard to know what you don't know, but When we look at the testing that is typically done in our county, the vast majority of it is done through either our public health lab or our Optum lab or within our local healthcare facilities. And those are not impacted or were not impacted by this. So people who are tested, their tests were sent to an outside commercial lab and may have impacted our counts. Most typically, local providers will reach out to us when they get the information on these positives. We don't normally have to wait to see it in our state surveillance system. So I'm hoping that the impact will be relatively small. That being said, it certainly, we'll see what the numbers look like. But compared to a lot of large counties, I think we will actually be less impacted. The case counts that we had last week were not related to this at all. It was simply related to case development in our county.
Thank you. The Lost Coast Outpost asks, many epidemiologists are now arguing that the country could be deploying fast, cheap, and not terribly sensitive saliva tests that could be administered at schools, workplaces, or in the home. The idea being that the quantity of such tests would be more than compensate for their lower quality. Is this approach gaining traction in state public health circles? Do we have such tests available in Humboldt County in any quantity? Are they on the horizon?
So obviously, because of the challenges in getting testing to everyone that we would like to test, there are a lot of people creating various testing platforms to use. As pointed out here, there is a broad range of how sensitive and specific those tests are and whether they advance or sort of harm the overall process. I think that we're looking at each of these as they come along. The state health department vets these as well, and they provide us with information about what they're looking at as a good test. And then we look at it, and we have a lot of expertise in our lab manager here to do that as well. So we are really looking forward about what we could offer here locally, but I will tell you that from a local public health standpoint, using time to do contact investigations and our resources to do that for people who are not actually sick with COVID or missing people who actually are sick with COVID because a test underperforms is a big deal. We put people in quarantine based on test results. That means they can't work during that time. It has other impacts as well. So from my standpoint, I want the most accurate test I can get. That being said, there may come a point at this where we are just trying to do mass numbers of testing, and we'll have to accept some of these limitations of tests, but I don't think we're at that point yet. So we certainly have seen some increase in the percentage of our cases in children. Really that what we've seen internally is that much of that is actually just household. So we certainly know that when we have a household with multiple individuals, the transmission rate is really high in that setting. It's very likely that multiple individuals in the home will become infected. And so children get swept up in that as well. We have not seen that in terms of children being the original case as often in a home and in a more widespread sense across the county. So, I think we will see this percentage grow in children, and we will, be monitoring that ongoing. But right now it seems to be primarily associated with household contacts of cases.
Thank you. The North Coast News asks, just as thousands more students return to classrooms this week, another study shows how easily children can get coronavirus. More than 97,000 children in the U.S. tested positive for coronavirus in the last 2 weeks of July, according to a new report published by the American Academy of Pediatrics and the Children's Hospital Association. At what point would you consider reversing course and closing schools entirely again for in-person instruction?
So, we take this really seriously, and we're monitoring our epidemiologic data daily, as well as our hospital data. and our capacity along things like testing and contact tracing and such. So when we look at the number of cases in children, I guess locally what I would point out is that we are certainly not meeting criteria for the county monitoring list, which necessitates doing distance learning. Certainly our trends in the last few weeks concern me. And there may come a point along the way here where we are seeing just enough transmission that it isn't feasible to have even the relatively small number of schools that will be offering on site continuing to do so. But we're not quite there yet.
Thank you. The North Coast News asks, California's top public health official has resigned just days after the state announced a fix for a glitch that caused a lag in reporting coronavirus test results used to make decisions about reopening businesses and schools. Did the glitch that caused a lag in reporting test results impact Humboldt County's data?
And again, I would just note, we answered this previously, but we to date have not seen this. The state, as I understand it, has really gotten nearly all of these results, if not all of them, into the platform where they can be seen. And so we'll be looking at all of that, but to date, we're not aware of it having a significant impact on our case numbers.
Hermosa Beach officials said the city is using a private consulting firm to help police enforce an ordinance requiring face coverings in public areas, the LA Times reported Saturday. Would you support local officials if they resorted to such actions to enforce your orders here?
Well, obviously I'm open to any discussions about things that we can do to improve enforcement, but that certainly would be informed heavily by what local law enforcement feels they are able to do in our local areas to be able to increase adherence to orders.
Thank you.
Thanks.
Yeah, and thank you for your time this afternoon.
Thank you.